welcome again. We have a lot to go through today, and so we were going to take this systematically. We won't go into the full details on some of the questions or some of the background behind it, but we encourage you to reach out to your country teams. There's a lot of dedicated staff here at the Global Fund Secretariat in Geneva to help support answer some of those questions. And we've also indicated in the slides where we will have forthcoming dedicated webinars on some additional topics. Now, before we start through the walkthroughs of the forms, I'd like to introduce you to a few concepts related to applying for funding overall in the 2023 to the 2025 allocation period. My colleague Philippa will take you through the funding request annexes, which are the same for both the full review and program continuation approaches. We'll start with required annexes, and then we'll go into additional annexes that are only submitted for a subset of those portfolios. Then I will take you through the full review funding request application form. I'll be highlighting key areas which might need more attention. Next, Philippa will walk you through the program continuation application form. And then again, our colleagues at the Secretariat will be answering questions in the chat throughout. But if there are bigger questions or questions that we want to make sure are answered in all 4 languages, we will get to them at the end. So, just a refresher, there are 5 different applications approaches for the 2023 to the 2025 allocation period. And these are the same application types that we had in the last funding cycle. Today's session is specifically for the full review and program continuation application approaches. The other ones will be covered in separate sessions. The dates are included on the screen, so you can register for that. Applicants who are most often country coordinating mechanisms, and we refer to them as CCMs. We use this abbreviation a lot, so I'll repeat: country coordinating mechanisms, or CCMs. They are requested to apply for funding using a specific application approach by the Global Fund, one of these 5 on screen. The specific application approach is communicated to each country in the allocation letter sent starting in December. Now, although the criteria for determining the application approach for the 2023 to the 2025 period has not yet been approved, roughly speaking, this is how it will likely work. The full review is the default approach for core and high impact countries, which are countries with high disease burdens and larger allocations. Some core and high impact countries, which have robust national strategic plans, are invited to use the Tailored for National Strategic Plans application approach, which encourages them to reference documentation in their NSPs rather than repeating the information in the narrative. And again, we use a lot of acronyms. I will try not to use so many, but National Strategic Plans, or NSPs, is one that we can't get away from not using, so I will use it today. So if a country used a full review or a tailored for NSP approach last cycle, they have high performing grants, and they don't anticipate a significant need to change their programs, they may be invited to use the program continuation approach. Again, it's the Secretariat that makes the decision of which application approach is recommended to applicants. This application approach is communicated in the allocation letter. And once the selection criteria have been formally approved, more details on the different application approaches will be included in the applicant handbook. So on the last slide, we referenced the core and high impact portfolios, the ones that are eligible for the full review and program continuation. So here's a list of the categorization used in the last cycle, 2020 to 2022. Now, since the categorization is linked to final allocation amounts, this list can't be finalized for the next cycle until the allocations are finalized. So once a new categorization is approved, it will be published in the operational policy manual. Once you look at the slides, you can see that there's a link that will take you right to that manual. It's one of the first pages. So before we get into the details of the annexes and the application forms, I wanted to note that our preparations of the new materials started with listening to applicants and to partners. We received over 1,200 responses to the applicant survey in the last cycle, where people were overwhelmingly positive about the process of applying and the forms that they use to apply. So we asked what you thought, and we just wanted to let you know that we hear you. Filling out a funding request is a lot of work, and we've done what we can to simplify things where we can. Now, while we were very much focused on the feedback you provided, we also have a new strategy, which is very ambitious and required a step change in our approach to the applications. And so we know that there are high expectations around the partnership, but we're starting from a good base, and we have a lot of experience supporting you, the applicants, through these steps. And you may have seen this visual representation of the Global Fund strategy again, but we'd like to show you a different view of the strategy. We are introducing some new icons that tie to the strategy areas, and we'll show throughout the presentation to help you understand how the new applications are linked to the new Global Fund strategy. Now, the Global Fund strategy and explaining it isn't the point of this session, but we do have a recording of a session specifically on this strategy called Achieving Global Goals Together. You can watch this if you haven't already by clicking through the links on the slides, which, as a reminder, you should have received by email if you had registered before 6 p.m. at yesterday Geneva time. But if you haven't received it yet, don't worry, you can download the slides as well as review this presentation tomorrow or the day after on iLearn. Now, throughout today's session, we do want to illustrate how the expectations of the partnership have been realized in the materials for this new cycle, hence showing how the strategy is so linked to the forms and to the annexes. Finally, before I hand things off to Philippa, we have country dialogue. And country dialogue is a vital part of the funding application process. And while it is expected to continue throughout the grant's life cycle, there is an intensive country dialogue during the development of the funding request at the beginning of each funding cycle. And at a high level, the country dialogue process is how all the stakeholders involved in the response who are impacted by the 3 diseases, they come together, review progress and challenges, and then agree to the best way to combat the 3 diseases going forward. And this process is led by the CCM rather than the Global Fund. And this can and should extend beyond the CCM to include non-CCM members and wider groups, everyone important to fighting the 3 diseases. This kind of engagement is a core principle of the Global Fund. It is about questioning assumptions about what is working or what is appropriate for each group, and then ensuring that the continuous effectiveness, equitability, and targeting of disease programs is improved. The Global Fund's new strategy introduces a number of key strategic shifts, which we believe will also increase the impact of programs. And it is important that these shifts be considered in light of each country's unique context, and they be considered during the country dialogue to show at the funding request stage how the investments from the Global Fund will be used to drive impact. Now, on the right of the slide, we see the expected outputs of the funding request stage. Now, some of these outputs are informed by the country dialogue, but are not necessarily expected to be discussed in the dialogue itself. So the program split, for example, is the responsibility of the country coordinating mechanism, but it's a decision by the CCM that should be informed by the discussions around health system and disease program priorities during the dialogue. As shown, one of the outputs is the complete funding request and the annexes. Some of these annexes we actually recommend to be partially or fully completed early on, so they can help ensure country dialogue discussions are evidence-based. We discussed which annexes should feed into country dialogue during our recent training called Country Dialogue Expectations. A recording of this is available on iLearn already, and we recommend that you watch it if you weren't able to participate in the original session. So to walk you through all of the annexes, I will now hand things over to Philippa.
Thank you, David. So in the next slide, we can see all of the required annexes for both the full review and the program continuation applications. So why are we starting with the annexes? Well, first, this will show how the new Global Fund strategy is reflected in these annexes. And second, because it's the content of these documents that will then feed into responses on the application forms. Also important is that annexes are an important tool to improve the quality of the country dialogue. So in the top row in pink, we have annexes that you are already familiar with that have been updated for this cycle. In the middle row in orange, we have some annexes which are new and or that have had substantive updates. And finally, at the bottom in blue, we have annexes that mostly need referencing, compiling, or assembly. I will spend a few words on each annex, but we recommend that you review the instructions for each of these resources, reach out to the country team if you have more questions, and also listen to some of the webinars that David already mentioned that have already taken place or that will take place in the near future. So first we have the performance framework that provides the indicators for impact, outcome, and coverage, and includes a work plan tracking measures when the coverage indicators aren't possible. An important change for the cycle, which mirrors the change in the modular framework handbook, is that modules and interventions are now listed by population. So for example, for TB, DRTB programming for key and vulnerable populations as a model, we have separate interventions for people in prisons, migrants or refugees, miners and mining communities, the urban poor. Other improvements to the performance framework include built-in error reporting and reverse indicators with appropriately declining targets over time. We plan to offer a webinar on the detailed approach to how to complete and use the performance framework, as well as in learning, both expected in January next year. So tied closely to the performance framework, we have the detailed budget that shows the cost of what is prioritized for the allocation funding. Just to flag a change that also is highlighted in the slide, which is that the budget is being requested by year instead of by quarter for this cycle. Both the budget as well as the performance framework are custom generated for each country by the Global Fund country teams. We are also planning a dedicated webinar and a new learning on the budget, again, both expected beginning of next year. Next, we have the prioritized above allocation request, or PAR, which is submitted with the funding request and outlines specific modules, interventions that the applicant would implement if additional funds become available. So prioritized and costed modules and interventions that are included in the PAR are evaluated by the technical review panel, and if approved, are then placed on the register for unfunded quality demand, or UQD. These modules and interventions can then be integrated into the grants when savings or efficiencies are found, either during grant making process or implementation. Similar to the performance framework and the budget, the PAR template is also generated by the country team and sent to applicants. It is important that the most critical modules and interventions for programs are included within the main funding request. A reminder that the PAR is a required attachment for the funding request submission and must include at least one item. Also important to flag is that applicants may only submit an updated PAR during grant implementation with the agreement of the Global Fund. So an update may be justified by significant changes to the country context or when there is a realistic expectation that additional funds will become available. So considering the limited circumstances in which a PAR can be updated, we definitely recommend to carefully consider the elements to include in the PAR before the funding request submission. Next, we have the programmatic gap tables that summarizes country needs, national targets, the gaps in programs that need to be funded to meet those targets, and this has not changed. Programmatic gap tables show the change achievable by domestic and external contributions along with the Global Fund support, then displaying the needs and the gaps in the selected modules that are key to achieving impact. They include coverage targets, which are very helpful when prioritizing what should be covered by the allocation and what should go into the PAR instead. So what is new for this cycle? We have now a community health worker gap table that looks across the 3 diseases and also RSSH. Overall, the programmatic gap tables have been aligned with the new modular framework handbook. This means that Some new tables have been added, for example, for severe malaria treatment, and some tables have been removed, such as the one on male circumcision. Next, we have the funding landscape table, which has also been refined and improved for this cycle. It continues to illustrate the total funding that is needed for the health program and how the country plans to come up with that money, either through domestic resources, other external donors, and the Global Fund investment. The funding landscape enables applicants to have a good idea of how much money will be needed to finance their health programs. It also makes it easier to see trends on how specific interventions are funded, which is very important for the sustainability of programs, especially those supporting key and vulnerable populations. Key changes for this cycle includes a new health product page, given the amount of co-financing commitments focused on health products, and also additional years of expenditures on co-financing to better see trends. And finally, we have the health product management table, which shows all health products and health technologies that will be funded by the Global Fund. To note that this annex is only required for applicants that are requesting funding to cover health products or associated management costs, which realistically applies to the vast majority of core and high impact portfolios. So we move now to the annexes that are new or that have had substantive updates. And we start with the RSSH Gaps and Priorities Annex that encourages the 3 disease communities to have a joint data-driven discussion on what the RSSH priorities and gaps are. The aim is to ensure that there is a joint decision-making and ownership of the RSSH funding amount that each of the 3 diseases will contribute to. And this is reflected also in the new program split template that asks that each disease component spells out their contribution to RSSH. We clearly have a more deliberate approach from the start to designing investments in RSSH, which are particularly important for this allocation cycle because of the impacts of the pandemic on health and economic systems. So the RSSH Gaps and Priorities Annex consists of 3 sections. Section 1, it's the analysis of the RSSH priorities, including those related to community system strengthening based on program gaps. Applicants are asked to identify the top 3 priorities for RSSH by model for each disease program, and to briefly explain how investing in these areas will actually help to address specific programmatic gaps for HIV, TB, and malaria, while contributing to RSSH and to pandemic preparedness. In section 2, we have the prioritization process. So based on the analysis done before, applicants are asked to explain the approach that was used by the disease programs to collaboratively discuss and prioritize their health and community systems bottlenecks. They're also asked to summarize why these RSSH areas have been prioritized between the 3 diseases for inclusion in the funding request, and then to explain how these priorities are aligned with those articulated in their national health sector plan or other key national policies and strategies. And then finally, section 3, which is the funding gap analysis to be submitted for those RSSH models that are the main cost drivers. This annex has been further discussed in the country dialogue expectation sessions that David has already mentioned. It's available on eLearn, and we invite you to listen to it if you missed it for further information. Let me just flag here that it's recommended that the RSSH annex be filled in early in the country dialogue process, ideally before or during the program split discussion when the RSSH funding is earmarked, ideally equally from all the 3 diseases. Applicants are required to submit the same RSSH annex with each funding request. It should be updated if separate funding requests are submitted for different TRP windows. And here we would like you to refer to the technical review recommendation to, if possible, submit the RSSH request all at once, ideally with the first funding request. And in the base case scenario, have all the funding request components submitted together. So the essential data tables, they provide key figures related to country and epidemiological context. Applicants are asked to validate sections with pre-fill data and then to provide further information as indicated. It's not a new annex, but it has been updated substantively. What is new is that essential data tables now include new tabs, which applicants are requested to fill in. These tabs will be used to establish the program essentials baseline for TB and HIV. So what are program essentials? These are key evidence-based interventions and approaches to address the ambitious goals set out in global plans. For our SSH, we refer to critical approaches, which are specifications for interventions that are funded by the Global Fund. The aim is that these evidence-based recommendations and best practices are increasingly adopted by countries. So for TB and HIV, data is requested in the essential data tables. For all three diseases, applicants are asked in the forms to describe where they don't meet these essentials and what they will do to work towards achieving them. As we go into the forms later in the presentation, we will show you where this question is. Just a final note that program essentials and critical approaches are described in detail in the specific information notes. So next we have two additional new annexes, the funding request priorities from civil society and communities, and the country dialogue narrative. As was mentioned at the beginning of the presentation by David, one of the expectations is to have people and communities at the center of our strategy to make sure that we are really hearing those voices. And an opportunity to do that is to have the expectation that civil society and community groups come together to provide a list of the top 20 areas that they would propose for the CCM to consider in terms of what would be the most valuable investments that would make the biggest impact from their own perspective. And we're asking this annex for three reasons. One, it's an important and a useful exercise for civil society and community groups to discuss what their priorities are. Two, this is also a very valuable input for the CCM as they consider the prioritization for the funding request. And then three, it provides an insight to the Global Fund on how these needs fit with the amount that is being requested under allocation, under PAR, as well as to whether and how those needs are reflected in the grants themselves. So we believe this will be a useful exercise and an asset for the wider Global Fund partnership for the next cycle. We also have the country dialogue narrative, which allows the CCM to describe in writing how the inclusive and transparent country dialogue was undertaken at the funding request development stage. To note that the evidence of this inclusivity needs to be kept, but it doesn't need to be submitted unless requested by the Global Fund Secretariat. So as you can see in the slide, the little icon color has changed, and we have now reached the annexes that mostly need referencing, compiling, or assembly. And we start with the national strategic plans. As you know, the allocation-based funding model emphasizes this alignment to country process. It incentivizes the development of robust, costed, and prioritized national strategic plans, as well as the overall national health strategy. With national strategic plans, we demonstrate the country's ownership of the disease programs, which is a key principle for the Global Fund. Now, we specify national strategic plans, but to note that there are other documents which have been adopted by countries that should be considered as well. Next, we have the additional co-financing documentation. So the core documentation is already integrated with other funding request requirements. It includes the narrative on the co-financing in the forms, the funding landscape table, and the commitment letters, which are ideally submitted before the funding request submission or at the latest by grant approval. And this is a requirement for all portfolios. So additional documentation may include, for example, documentation on realization of co-financing commitments, expenditure reports, or details on uptake of specific interventions. As noted in the slide, there will be an upcoming webinar on the 30th of November that we encourage you to attend for more detailed information on this topic. Next, we have the CCM endorsement of the funding request and the CCM statement of compliance. These are not new. The CCM endorsement of the funding request requires that each member endorses the funding request. The CCM statement of compliance focus on the 6 CCM eligibility requirements and focus of the application requirements. Just a reminder that the Global Fund Secretariat screens for the first 2 eligibility requirements, which are related to an inclusive country dialogue and an open and transparent principal recipient selection before the TRP review. A recommendation here. It is critical that the Global Fund has the right people from CCMs listed in our database. This should be updated and completed well in advance of the submission of the funding request. CCMs can do this themselves, as the CCM Secretariat focal points are able to make changes, for example, following elections, by raising a change request through the partner portal. Also to note that the country teams may be reaching out to confirm to CCMs that they have updated their contact. So we saw the required annexes. Let's now look at annexes that are required only for a subset of applicants. In the top row, we have annexes that are only relevant in specific circumstances. And on the bottom row, we have other annexes which should be submitted if available. And also the sexual exploitation, abuse, and harassment assessment, which is optional or only requested for countries which are part of the dedicated pilot. In the next slides, I will talk a bit more about each of these. In terms of sustainability and transition supporting documentation, this may include a transition readiness assessment, if available, a transition work plan, sustainability assessment, sustainability plan, etc. If these are not available, but other documentation exists to demonstrate efforts to strengthen sustainability of national responses, this can also be included. If available, applicants should also include any materials that substantiate the government efforts to strengthen the health financing and the financial sustainability. Regarding innovative financing, if applicable, the exact documentation required will actually depend on the mechanism that is being used. So more information on all of this, including innovative financing, will be provided during the upcoming webinar on the 30th of November. The implementation arrangements map is also not new. It's a visual depiction of the relationship between funds, organizations, and programs that are part of a grant or a set of grants. It is required at the funding request stage if the principal recipient remains the same, or it can be submitted during grant making if the principal recipient is new. So next, we have 2 new annexes, the Human Rights Assessment and the Gender Assessment. Evidence has shown that we will not defeat the 3 diseases unless we remove human rights-related barriers and increase gender equality. And the new Global Fund strategy is very clear on that. We know that many CCMs, civil societies, governments have already worked on human rights assessment and gender assessment. So the request is, if these are available, please attach them to the funding request submission. The gender assessment is an analysis which helps to inform the request and is used to measure progress towards gender equality goals. No standard template or format is required for the gender assessment, but its inclusion is a core part of being able to achieve a higher score in the gender equality marker, which I will talk in the next slide. So the gender equality marker, or GEM, will be assessed on each funding request that's reviewed. The aim is really to incentivize, track, and report on how the grants contribute to advancing gender equality. For the 23-25 allocation period, the GEM score for funding request will be assessed by the technical review panel. Important to emphasize here is that the score is aimed to help establish a baseline. So applicants won't be penalized for having a low score, but instead will have specific areas which they can look for to improve in the next cycle. And finally, we have the sexual exploitation, abuse, and harassment assessment. This is very important to the Global Fund, as the organization is very intentional about exploring further how we can protect against sexual exploitation, abuse, and harassment. For the upcoming cycle, there will be 10 countries that will be requested to submit this assessment. Details on which countries will be selected, how they will be notified, what support will be provided, will be shared very soon once finalized. For all other countries, a template is already available if they want to start that thinking. Again, not a required annex except for those 10 countries that will be identified for the pilot. I will now hand over to David for the walkthrough to the full review form.
Okay, thank you, Felipa. So I helped draft the forms and instructions, and so I want to share with you what is different with them. And we'll get to the forms here in a second. But before diving in, I'd like to start with the instructions. And I'd like to reiterate that these instructions are essential for correctly filling out the forms. As you see on the slide, the question on the form is quite simple. Describe the main challenges to the country context since previous funding request submission to the Global Fund. It's compact, it's short. But in order to answer the question, each of the question elements from the instructions, which are shown in red on the bottom part of the slide, they need to be responded to. So unless each of the requested elements is spoken to in the response, the answer to that question will not be complete. So for each instruction, you will see the question elements, which each need to be answered in order for the question to be considered complete. Then each element has different details, which should be considered or spoken to when addressing that question element. And please pay particular attention to what is being requested in the details. So this is explained in the instructions, but words like describe or indicate are asking you to please include or please refer to this information in your response. In comparison, consider is very much intended to be prompts for areas for consideration. So for example, in the first question element, the element is asking for the impact that COVID-19 and other emergencies had on health systems. The detail column for this element might ask that they consider climate change related events. Now, applicants don't need to talk about climate change related impacts in the response if they haven't had any, but they also, when reading any other emergencies, they might not have immediately thought about climate change related impacts. So to consider is really to encourage a thought process in a certain direction. So for this session today, we will be discussing mostly about the questions themselves, not about the elements or the details. And we'll be referring to the elements or details only when there are areas that we want you to look out for. And so we encourage you to look early at the instructions to make sure you really understand what is being asked. And so while the instructions shown here are from the full review, the way the instructions are presented is the same for program continuation as well. So starting with the full review. You might have seen this blue column before from our overview trainings if you joined us for those. The full review starts with the rationale. It's an overview of what is being requested and why, both within the allocation and beyond it with the above allocation request. It's also the country context section, really focusing on what is new and different since the last funding request, the lessons that have been learned, and what changes have been made as a result to the changes in the context and these lessons. Starting with the prioritization table. We want to focus that this table is at the level of intervention. And this means that all of a specific type of intervention should be shown together. For example, the intervention might be condom and lubricant programming. An applicant might have condom and lubricant programming for transgender people, for sex workers, for men who have sex with men, or for people who use drugs. And all of these should be shown together as one intervention. And we recognize that this might look different than how this information is presented in the performance framework, where modules and interventions are about population, or from the modular framework handbook. But including it at this level, at the level of intervention, really helps the technical review panel in the review of the requests, seeing everything in one table together that is requested. Now, the example of a full review funding request is being developed, and we're very excited to be able to share this with you in this cycle, where we hope within the next few weeks to be able to publish this. And so you can go in, and it does a really good job of showing how the requested intervention in each column can be shared at that intervention level. We did want to mention that based partially on this exercise of creating the example of the full review, we'll be updating the form slightly in November to switch the axes of the tables. And this greatly helps with readability. And so instead of having vertical columns, module, it'll be switched around, and so it'll be horizontal. And this helps again with readability. The next question is on payment for results. This is a modality in which the Global Fund makes payments based on the verification of the results being achieved. This approach allows for the flexible use of grant funds within pre-agreed parameters and is not based on monitoring or managing the inputs. When responding to this question, applicants should only consider payment for results at the level of the program. So any proposed use of incentive payments at the facility or provider level or on an individual basis, this should be discussed in section 3 on implementation arrangements. Now, if you're interested in using payment for results, please contact your country team. And if no payment for results modalities are used, please just delete the table and respond with no payment for results modalities are used. Fairly simple. Next question is on the rationale for the allocation. The section on rationale is really important, and it's about the investment approach or how the request was prioritized. Considering the replenishment, changes in exchange rates, slow programmatic progress because of COVID, we really need to ensure that the funding that we have available is being put to the best use possible. The phrase used in the strategy is just as important as more money for health is more health for money. And so we especially refer people to the value for money technical brief. And the idea with this question isn't to discuss as much the modules themselves. The hope is for more of a discussion on the rationale, on the evidence. So you might even include a theory of change diagram here to explain the thought process behind your request. Next, we have the rationale and for PAR. And in contrast, this is the question asking for the what of what is included in allocation versus PAR. Applicants are asked to describe their high-level approach to deciding whether interventions should be in the PAR versus allocation funding. Applicants are requested not to list or describe all the interventions from the PAR. Since blended finance investments or debt swaps might be funded through the PAR, interested applicants should definitely include that in the section, and if they're interested, they should join the forthcoming session, which we have on sustainability, transition, co-finance, and innovative finance on the 30th of November. Context question. With this question, we really want to emphasize that what we are asking for is changes since the last time the TRP looked at the funding request for that component. So the TRP will already be looking at previous funding requests. So applicants don't need to repeat everything that's there. They just need to really focus on what is different, especially looking at areas of change that might impact the disease programs or communities. Both positive and negative changes should be considered when responding to this question. And again, the descriptions of that context should be a lot more focused than in the past. And referring back, that model full review funding request does a good job showing just how much more limited the response to this question can be. So definitely check that out as soon as it is published. Lessons learned. This section should focus on adaptations and mitigations to respond to the country context. And so that should speak to that previous question. Lessons learned can include lessons from programs supported by the 2020 to 2022 allocation period, but it can also include lessons from catalytic investments, such as matching funds, or from the COVID-19 response mechanism. Focus of application requirements. As a reminder, applicants should need to focus all or part of their funding requests on key and vulnerable populations and/or highest impact interventions within the defined epidemiological context. Now, these requirements are described in the Sustainability Transition and Co-Financing Guidance Note, and the specific requirements pertaining to each country will be found in their allocation letter. Matching funds, only applicants which are receiving matching funds need to answer this question. And this, if applicants receive more than one matching funds area, this question needs to be repeated for each area. The questions are mainly on how matching funds can help achieve the highest impact and improve the outcome of allocation, and considering how conditions will be met. If past matching funds were received, applicants are asked to please describe the impact of that. Guidance on this is in development, and we're planning a dedicated session on matching funds in December. Our next section is on maximizing impact. It's about strategic alignment to global goals and sustainability transition and co-financing. Now, we recognize that we have an ambitious new strategy that covers so many different important areas, but we also recognize that it is important to not have investments which are spread too thin. So investments don't need to speak to every area of the strategy. Again, they do not need to speak to every area of the strategy, but the country-owned program that the investments are going into should be aligned. So the focus of this section is on programs, not only on the Global Fund investments. So our primary objective is ending AIDS, TB, and malaria, and that hasn't changed. This question is about how program design will achieve the greatest outcome against that objective, as well as looking at the root causes for stalls or regression. The focus is on how program interventions were designed with a strong emphasis on value for money. In the last cycle, the technical review panel found that a lot of times programs were stalling or they were regressing, but this was rarely acknowledged in the forms. Rarely were the root causes investigated or acted upon. And so this question focuses on that. This is also where malaria applicants should be describing the stratification and subnational tailoring that went into their request. This is also where applicants are asked to describe the program essentials. And again, to repeat, the RSSH critical approaches are not discussed here. More on RSSH though. This question is structured slightly different than others, with several question elements that are for everyone, such as integration, program quality, private sector engagement, and environmental impact. There's also some questions which are only for applicants requesting certain types of investments, such as in community system strengthening, community health workers, data, supply chain, or in lab systems. So the triggers here for whether a question needs to be answered or not, they aren't as clear for some of these additional question elements. So please carefully consider and ask your country team for input as to whether you should be answering these additional question elements. The environmental impact section is discussed here. And we just wanted to highlight that because we know that this will be receiving a lot of attention from the partnership. Moving into the engagement and leadership of communities. As our new strategy highlights, our fight requires communities to be engaged much more in the design, in the implementation, and in the monitoring of the programs that we support. So this question is a key reflection point for the CCM to consider how most affected communities were involved in the development of programs and the prioritization of interventions, but also to consider how these communities will continue to be involved throughout the life of the grant and in the ongoing monitoring and continuous improvement of the programs. Next, we have health equity, gender equality, and human rights. Similarly, in this section, applicants must demonstrate how the proposed interventions will do no harm or even contribute to improving health equity, gender equality, and human rights, which are a key strategic objective of our new strategy. And we recognize that in many cases, applicants have already performed the assessments related to health equity, gender equality, or human rights. So this section asks applicants to refer to these assessments and attach these assessments to the funding request when available. Examples of these are the Malaria Matchbox tool, gender assessment tools from UNAIDS or Stop TB partnership, or the forthcoming Human Rights Rapid Assessment tool. As we've shown elsewhere, the rationale for the prioritization is very important. Not every population can always be addressed with the funding request, but the rationale should be explicit on which populations were prioritized, which barriers will have the biggest impact if they are addressed, etc. So we do want to call attention, though, that overall, Section 2 focuses on programs. But one of the question elements for specifically question 2.4a on health equity is very explicitly about which populations are prioritized for investments. So this should be clear in the instructions, but I just want to highlight to watch out for that as you are going through. Next, we have questions on sustainability. Applicants aren't asked to describe every sustainability challenge. They're not. Instead, they are asked to describe their most prominent sustainability challenges and then detail how they are working to address them with the support of the Global Fund if needed. Applicants are also asked to consider different dimensions of sustainability. The first one that comes to mind is normally financial, but it's also important to consider programmatic sustainability, the sustainability of health and community systems, and sustainability of governance. National health sector financing plans are important to reference here, and the sustainability transition and co-financing guidance note and value for money technical briefs are important guidance for applicants when considering this section. On co-financing, these questions focus specifically on how and to what extent the country has realized the co-financing commitments made during the 2020 to 2022 allocation period, and then how the country will increase domestic financing and co-financing for the national response and for health systems throughout the 2023 to 2025 allocation period. When developing the funding request, it will be important to consider co-financing requirements and refer to the domestic financing section of the allocation letter. Although they are not required until grant making, applicants are also encouraged to include the commitment letters if they are already available. And we remind you to be in close contact with your country team as you review the co-financing commitments. Now, this next question on innovative financing is another only if relevant question. It's not going to be applicable to everyone. Innovative financing approaches include debt to health and our joint investments with development partners. And these are prioritized within the new Global Fund strategy. The Global Fund is developing a new policy that will help simplify this use of blended finance. And this will be able to be referenced if there are questions on specific processes related to those transactions. So if you think an innovative finance modality might be appropriate for your country's context, please consult early with your country team. And then a reminder that there is the session on sustainability transition, co-finance, and innovative financing on the 30th of November, which will include a focus on this. Then pandemic preparedness. The focus of this is on building pandemic preparedness capabilities. And we want to acknowledge that pandemic preparedness has specific focus in the forms, especially as an evolving objective in the new strategy. But we also want to emphasize that it is a part of RSSH, and it is reflected in RSSH modules and interventions in the Modular Framework Handbook and in the Performance Framework. And then pandemic preparedness, although a part of RSSH, may not have been included in country dialogue discussions in some contexts. Given the increased focus on this, inclusion of stakeholders involved in pandemic preparedness and response in the country dialogue will be important. We just want to highlight that. We also want to acknowledge that investments in preparedness for response, such as in surge capacity, can be difficult to distinguish from actual health emergency responses in certain contexts. However, when planned, these investments should focus on ensuring the capacities for effective response, but not actually finance specific response activities. The last section of the full review, I'm almost done and can hand back to Filippo. The last section is on implementation. This section looks at how the requested interventions will be implemented, how they will be centered in communities, and how they will ensure that certain key risks which need to be addressed at the program design stage have been mitigated. As mentioned earlier on the question on payment for results, this is where incentive payments should be discussed. And we want to know that there aren't specific questions or question elements related to incentive payments in this section. Instead, the implementation arrangements and risks for this implementation modality should be addressed and highlighted in the other responses to the questions in this section. So, implementation arrangements. This is a very important area for value for money considerations, especially related to effectiveness and efficiency of the implementation. This will be a key focus area for the technical review panel. We encourage you to review their findings from the last cycle, many of which referred to the implementation arrangements in the funding requests they were reviewing. High program costs, problems related to devolving management to subnational levels, or slow transitions from INGOs, international NGOs, to local governments, were all frequent issues in the last cycle. So we encourage you to check those out. Community organizations. Evidence has shown that community-led organizations, or CLOs, are often best placed to reach out to marginalized, discriminated against, and even criminalized populations, which, in the context of HIV, for example, account for 70% of new infections. Their role is therefore crucial to ending the epidemics. This section is important as it allows for the CCMs to reflect on the role they are given to CLOs in implementing the programs. In this question, applicants are asked to explicitly evaluate the value opportunity cost of using or not using community-led and based organizations instead of other stakeholders in the implementation arrangements. They're also asked to look at and address barriers that prevent community-led and based organizations from inclusion in implementation. Finally, we have risks and mitigation. And the approach towards the risk questions is quite a bit different this cycle. And I want to emphasize this. Only the top 3 risk areas, as described on the screen, are being evaluated with this question. The background to this is that responses in the last cycle on the risk questions were often either too long or they were a list of risks that was too long to be helpful in prioritizing. Sometimes it was too limited in scope to be helpful. And so the idea is to focus on key risk areas that need to be addressed during program design. This means that the only way to mitigate these risks is to change key program design elements. And so these need to be considered very early on. And to focus on 2. Among these key risk areas, focus on those which aren't addressed in the other questions in the form. And so that leaves us with these 3 areas for which only the top 3 risks, for a total of 9 possible, in these areas need to be considered at funding request development. Other risks can and should be identified, but these can be discussed during grant making. So with that, we've finished the full review form. I'll hand things back to Philippa to walk us through the program continuation form.
Thank you, David. So before we go into the form itself, we just would like to share with you, in this slide, you can see the draft selection criteria for the next cycle to determine either a component would be eligible for a program continuation application. So please note that this is a draft still and is subject to approval by the Grant Approvals Committee. And as you can see in the slide, criteria include that the component does not use a program continuation in the current cycle, otherwise you would have to go through a full review this time around. To be eligible for program continuation, we will also need that the grant and the program have demonstrated good performance in the current cycle, and that the allocation change would be less than the agreed threshold. If these criteria are met, the Secretariat would then assess whether material change is likely to be envisaged or needed. So again, still a draft and not confirmed. As David mentioned in the beginning, the application approach will be communicated in the allocation letter. So moving on to the program continuation form. You see here the 6 sections, which follow the same general flow as the full review form that David just presented. And we start with the prioritized request. The presented in a tabular form. It's essentially a scaled down version of the same table that David presented for the full review. It addresses requests to really highlight what is being funded. So the table encourages a concise response with the understanding that we will not be restating all of the information because we are continuing from the previous funding request. Other points already also mentioned by David for the full review are also applicable here. So the list of activities should be at the level of modules. The list of activities should not be differentiated here. And we will republish the table in a horizontal format to improve readability. Finally, the program continuation also has the same option to complement or replace this table by a payment for results table. The second section is on matching funds, the same as for the full review. So again, only directed to applicants receiving matching funds, and the questions should be repeated if there is more than one matching fund area. The aim is really to focus on how matching funds achieve the highest impact and improve the outcome of the allocation and how these conditions will be met. If there have been matching funds in the past, their impact should also be described here. Just a note that a dedicated session will be organized to take place in December to go into more details on matching funds. Section 3 is about specific changes in context, and we try to make it very straightforward, asking applicants to really focus on what has changed. If a component is eligible for program continuation, the assumption is that there haven't been major changes. Otherwise, applicants would be using the full review approach instead. So to ensure that the continuation of the program is still the best path forward, applicants are asked to consider specific contextual changes that may warrant program changes, that is epidemiological context or normative guidance or technical approaches. So the program continuation instructions include the different elements to consider when replying to this question. If after consideration, the answer is yes, there are significant changes to context, the instructions highlight elements that should be included as part of the response. If, on the other hand, the answer is no, applicants can just mark no and move to the next question. The next section is about what hasn't changed. And all applicants are asked to reply to this question, which is really about explaining how the program continues to be relevant. Although we know that key areas like health equity, people and communities might not have had the same prominence in the previous strategy, we do believe that many of the programs may already demonstrate alignments with the new Global Fund strategy. And to answer this question, applicants should consider inputs from technical partners and key stakeholders. The next section is about the strategic focus areas. Just as with the full review, these questions are about the strategic alignment of the program. The assumption is that, yes, the program is continuing, but it may already demonstrate alignment with strategic focus areas from the new strategy. For each of the areas listed under Section 5, applicants consider either the program design, implementation arrangements, the budget, whether they need to adapt to fulfill the strategy objective. A detailed response is only needed if applicants reply no or partially. Again, we try to encourage concise responses while making it very transparent to the reviewer the alignment with the strategic focus. The first three areas in Section 5 are about maximizing people-centered integrated systems for health, maximizing the impact and leadership of most affected communities, and health equity, and maximizing gender equality and human rights. If these areas are not already addressed in the current grant or are only partially addressed, applicants are asked to summarize the effort adaptation needed during grant making and or grant implementation. So as mentioned earlier by David for the full review, pandemic preparedness is an essential part of our SSH, but receives greater attention in the new strategy. And we recognize that programs may well already include pandemic preparedness elements, either as part of the RSSH or also noting the work with C19RM. Whether they are already addressed or partially addressed will depend on the context. So the question elements are the same as for the full review, but again, Response is only needed if no or partially is indicated. Always on the strategic focus areas, we now have a question on sustainability. To note that this time, it's the reply of no for major challenges that doesn't require a narrative question, a narrative response. There are a lot of points to consider related to sustainability, so please consider thoroughly the different question elements and details for this question available in the instructions. If the answer is yes, there are additional questions related to the impact of meeting co-financing commitments. Next, we have a question on co-financing, which is identical to what is asked in the full review form. Again, we stress that the ideal is to have a commitment letter already at funding request submission. Also, a key recommendation that the figures should match across the different documents submitted. There will be a dedicated session that I already mentioned, and David as well, on the 30th of November, and we encourage you to attend for more details on this topic. On the program continuation form, we also have a question, the same as the full review form, regarding the program essentials. And then the final section is about implementation. Since a program continuation approach is being used, it is assumed that the current implementation arrangements are still effective, both to deliver on the program objectives and to the anticipated impact for the next allocation period. With the same principal recipients and main sub-recipients staying the same, applicants are asked to explain any minor changes which are needed to make the grants even more effective. Key difference with this question is that there isn't a list of things to consider when discerning whether changes are needed. However, to maximize impact, we recommend reviewing the implementation arrangements through the lens of value for money. And the program continuation form is done. Much more straightforward. And in this slide, you have the planned TRP review windows for 2023 and the dates for submission of the funding request. The recommendation is to always plan backwards to discuss the timelines with your country team. So many of our grants are expected to start at the beginning of 2024. And the experience shows that we need to account for 6 to 9 months for the funding request development and grant making, depending on the country context. So the recommendation is really to try to build in time between signature and beginning of the next implementation period to complement the implementation readiness. For example, by ensuring that all implementation sub-recipients have been contracted and are ready to go on the day one of the new grant. This may require signing the grant 1 to 2 months before the implementation period starts, for example. So what can you do now? Any analysis, data gathering should be done in advance so applicants can really hit the ground running when the allocation letters go out, currently planned before the end of the year. I'll hand over now to David to manage the Q&A discussion. Thank you.
So thank you so much, Philippa, and thank you all for joining us today. We will now move to the question and answer portion. I see a lot of questions have been in the chat. I will do my best to answer the questions that come up. We may be joined by Lindsay Smith, who you'll probably recognize from past webinars and previous cycles, maybe some other colleagues from the Secretariat. But there's so many areas of expertise that are touched on or within these forums that we might not be able to answer all the questions you have for us today. Some of them might be answered in forthcoming versions of the FAQs, but we'll try our best. And so with that, let's go. Oh, got to move forward to the next slide. Okay. Question 1. In the last cycle, there was a soft recommendation of submitting a PAR with a budget that was roughly 30% of the total allocation. Is that still the guidance for this cycle? And again, I will invite Lindsay to speak up if I don't answer the question correctly, but yes, that is still the guidance for this cycle. Again, as Philippa mentioned, you can submit a a PAR of at least one item, but the hope is really that that there are interventions that have already been approved by the technical review panel, that when additional funding becomes available, that is already ready to be implemented and brought into programming. Lindsay?
Yeah, everything that David said is correct. The expectation from the Global Fund is that it benefits each applicant to think through in advance within the constrained funding of the allocation, what can be funded, and then if additional funding is available, what additionally would the right type of prioritized investments look like? And related to that, I think it's important to consider the programmatic gap table, the RSSH gaps and analysis table, for example, because scale up of an existing intervention that's somewhat funded by the allocation is a perfectly straightforward element to include into the PAR, for example. So our expectation is that each applicant will submit a PAR. It's a required mandatory attachment. And in terms of like how much to go into the PAR, it is not meant to be a full expression of demand. Certainly the Global Fund would never have the financing available, even if additional funds were to become available during the allocation cycle to fund the full expression of demand. But if we have to give you a guideline, it should be around maybe 30% of the total allocation. But like I said, that's a rough guideline. It's not a minimum, it's not a maximum. We don't measure it against the 30%. The PAR should really include the areas of prioritized importance from each country that ideally would additionally be funded if and when savings, efficiencies, portfolio optimization funding, additional financial contributions become available.
Okay, thank you. Moving on to question 2. So I will read it aloud. For civil society, should the 20 priorities be established for each disease, or are the 20 priorities established for the 3 diseases? And so for the civil society's priority and communities annex, the 20 priorities are to be established across the investments from the Global Fund. So the 3 diseases and any investments in RSSH.
Can I add to that, David? I think the way that I had interpreted the question was in the actual annex that's attached to the funding request, is it 20 priorities for the whole Global Fund submission? And the response to that is actually it's 20 priorities related to the funding request. So for example, if TB and HIV are submitted in a joint funding request, then the communities and civil society priorities, we would have a maximum still of 20, but it should relate to TB, HIV, and resilient and sustainable systems for health, which includes community system strengthening. If it is a malaria funding request, then the 20 priorities of civil society and communities would relate to malaria and RSSH. If it's an integrated funding request, they should be 20 priorities that relate to all 3 diseases and RSSH.
Okay, thank you. Moving on to question 3. Is there any recommended program management cost limit? I'll just ask that to you, Lindsay. I'll just read them to you.
So that one actually, one of my colleagues answered in the chat, which I was grateful for because that's not my area of expertise. But my colleague Sandra is part of the Resilient and Sustainable Systems for Health team, and so has some expertise in relation to what is a good guideline for program management costs. And her response that she left in the chat is that the Global Fund considers 10% as a maximum program management cost, but the Global Fund appreciates any attempts to have it as low as possible. And in fact, we would encourage applicants, we encourage CCMs to seek synergies with other donors and using, of course, national systems and implementers wherever possible in order to maintain a relatively low level of those program management costs.
Okay, moving to question 4, and I'll get that slide queued up. Could you explain again the criteria used to identify which country components are selected for program continuation?
Yeah, great. Thanks for putting the slide back on screen, David. So the Grant Approvals Committee is the Global Fund body that will finally approve the criteria that we will use to select which applicants are invited to use program continuation. That discussion at the Grant Approvals Committee has not happened yet. So the final criteria for the 23 to 25 period has not yet been established. However, it is likely to address these 4 areas that are on your screen right now. We will be looking at whether or not an applicant used a program continuation in the last cycle. That would be an exclusionary criteria, because if they did, then they would need to do either the full review or the tailored for NSP in the next cycle. We are also looking at the performance of the grant and of the national programs to make sure that those are on track to achieve highest impact. Because if a grant and a national program has been performing very well, that's a strong rationale to continue that program, hence the program continuation idea. The relationship to the size of the allocation funding is important because indeed we have in our operational policy a materiality threshold, which is 30%. So either if an allocation goes up more than 30% or goes down below 30% in terms of the overall the delta of the change, that would really cause us to question whether or not the existing program could be continued as is, or whether or not there would need to be substantive changes, material changes. And if indeed there was a material change to the allocation funding for that program, we would then likely think that the applicant would need to develop a more substantiated level of information and detail. So program continuation might not be the right approach. And then finally, we would also then use our own knowledge of the country team that works directly with the countries in implementation, whether or not they already anticipate that maybe it's due to the situation of the COVID response, maybe it's due to a substantive change in a government approach to the national program. There could be other reasons that even if a country was meeting the other criteria, if in fact the insight that we have about the program already can tell us that that would not be an easy program to continue as is, that would call that into question as well. But none of these are absolute. In all cases, when we finally do have the agreed criteria with the Grant Approvals Committee, we'll be looking at an approach which is more like a stoplight, and different color coding to say, this one is very close to the criteria, this one is very far away from meeting the criteria. And with that overall picture, then the Grant Approvals Committee will be the body that will make the final decision about the country components that are invited to complete the program continuation in the next funding cycle.
Lindsay, sorry, just connected to that, there's a question in the chat that is, why if the country have already used continuation, you wouldn't be eligible for this time around, the continuation as well?
Yeah, that's a good question. And in fact, this was a decision made by the Strategy Committee. So the Strategy Committee of the Global Fund has worked with the technical review panel and the Secretariat to look at differentiation criteria and the overall approach to the terms of reference for the technical review panel. And it was the Strategy Committee that made the decision that indeed the technical review panel should do a thorough, as in a full, complete assessment of programs at least every other cycle. And so that's why we're only able to invite applicants to complete a program continuation application every other cycle, if indeed they're eligible.
Okay, I'll put the questions back up. Okay, and so I don't see any.
There's a
questions.
Follow-up on question 1 that's at the bottom. Indeed, we are aware that we don't have a final sources of funds for the allocation yet. That will be going to the board for decision in the 3rd week of November. After that, the Global Fund will be working through the methodology to identify the allocation amounts for each country. But it is a reasonable understanding that if indeed we don't have pledges that take us higher than the amount that was pledged in the last cycle, that there will be less funding available for allocations in some countries in the next funding cycle. As a result, it may indeed need to have an increase in the articulated amount in the PAR to cover some of the additional gaps that may have appeared as a result of that. For example, gaps in essential life-saving services. If there are gaps in essential life-saving services, they should definitely be prioritized in the allocation. And then if there's no longer space in the allocation, then certainly in the PAR. Those would be considered a high priority.
I'm not seeing any new questions coming up. I don't have access to the chat. Could you please scan through and let me know?
I'm just taking a look. I think there was a question around co-financing that I think my colleagues have answered in the chat, which is that there are specific co-financing requirements for each country. Those are established for each allocation period and are communicated in the allocation letter. But a broad principle is that the Global Fund's requirements related to co-financing do require that applicants increase the amount of funding that they commit to their national health response in each consecutive period. And then there is a proportion of funding that is specifically communicated about that relates to the co-financing incentive target that is set at a different percentage level for each country, and that's communicated in the allocation letter.
We do have a new question that has come in. Why is it that most of the time the applications are for TB and HIV and RSSH with a separate application for malaria?
So the Global Fund's position on applications and joining up applications is that we encourage integration, but not just integration on paper. We also really want to emphasize that the idea is that we encourage integration in programming approaches. And there are a lot of synergies between the programming for TB and HIV that tend to not cascade as directly with malaria because co-infection of TB and HIV is so prevalent. We don't have the same type of co-infection scenario with malaria in most of these country contexts. That being said, we do have a number of examples where we have integrated funding requests, which include all three diseases and health systems as well. So certainly the Global Fund has seen this, encouraged this, and we want to encourage more applicants to look for synergistic opportunities. So opportunities to bring together the thinking behind where are there integration opportunities across the three diseases, for example, with community health workers. We would love to be able to see more intentionality to think about how setting up one program with community health workers that would be able to cover the three diseases would be even more effective.
Okay, we have another slide. We're getting more questions. So question 7, in this current climate, increased co-financing may be hard. Is it realistic to expect this, especially in the lowest income countries?
Indeed, we're very aware of the current economic challenging climate that we see globally. We see differences in currency exchange rates, which have a dramatic impact on the amount of funding that the Global Fund has available, but also the amount of funding that is available in many other countries. We've seen a lot of costs of health products go up. And so we know that even with the same money, the buying power has gone down. And we've seen a lot of the impact of the pandemic and the pandemic response have a negative consequence on many economies globally. So we're very aware of the circumstances that many of the Global Fund implementing countries are struggling with. So in all cases, that sensitivity and that awareness is definitely there. So in terms of, is it realistic? We have a policy and the Global Fund will continue to look at how we apply that policy in the most logical way possible, but consistent way possible as well. There are always the occasional circumstances that warrant a waiver of the policy, but this is very unusual. We would prefer to work with our countries to actually seek to secure the co-financing that is necessary to support the health programs, not just to support the Global Fund.
Okay, we have a question number 8. Can you please clarify the 20 priorities for civil society organizations. Is this number a maximum or a minimum?
Hi everyone, maybe I will take this, David. Hi everyone, my name is Gilles and I'm at the Community Rights and Gender Department at the Global Fund. So on this, because I think it deserves a response here in our session. This is a maximum, and I just want to give you a little bit more of the background of where this is coming from. This is actually a recommendation from what we've heard from communities during extensive discussions and consultations during C19RM. And on this new funding cycle. So we took this recommendation on board, and like it was explained by my colleagues earlier, really the objective is to get communities to agree on what we could call their programs essentials. You will hear that we have programs essentials. You will see that in the application package and application materials. And this list really of maximum 20 priorities per funding request is to get communities agree to what should be absolutely in the funding request. It doesn't mean that these 20 priorities or less, because 20 is not a goal, is a maximum. It doesn't mean that the priorities highlighted by communities will be in the funding request, but at the Secretariat, we would like to know what you had proposed as communities and if it was, included or not. Because it would be very useful information for us as we look at the gaps. So it's a maximum, it's not a goal. You don't have to get to 20, because what we want to do with that, as we heard from you, is to help you get to the CCM table. And when it comes to negotiating what is going to be included in the final funding request, is to really help you say, okay, these are really our must-have if we want to succeed in the response in the country. So 20 is the maximum, but it's not the goal.
Thank you, Gilles. Very helpful.
Moving to question 9, is there a rule or guidance on the proportion of Global Fund funding that should go towards commodity procurement versus towards program implementation?
Yeah, a difficult question because, as one of our other participants commented, essential life-saving services are driving so much of what the Global Fund has done in the past. It has, though, led to a commoditization approach in some very important grants. If we are looking at overall guidance, there isn't an overall guiding number that I'm aware of. And I see that my colleague has answered in the chat that it depends on the country situation. However, having commodities fully dependent on donor funding is not seen as sustainable. Indeed, if a country's first line or second line drugs are being funded from the Global Fund, we are all working towards the sustainable development goals of working ourselves out of this business by 2030. We therefore need to emphasize, as we work with our implementing country partners, how important it is for the national health programs to pick up those first line and then second line drugs wherever possible. Indeed, to be able to work on the sustainable approach that will be able to be sustainable longer term.
Okay. We've received another question about annexes. Will the annexes for program continuation and a full submission, the full review, will they be the same, or will the annexes required be different for program continuation?
Philippa, you were the one that was presenting on the annexes. Do you want to answer this question?
So the annexes will be the same for the two application approaches, and this is available in the slide. So all the required annexes are the same for full review as well as for program continuation application.
And if you come back and join us in a few weeks for our presentation on the focus portfolios, you will see that the required annexes are a little bit different, but for these two, they are the same. So we will see if we have, are there any more that seem to be popping up in the chat? Okay. So with that, I'm going to go to our closing slide here, questions. This is just to share our email address here. So if any more questions do come up, please email us. You can also send some of the questions or have that conversation with your country team. We encourage you to have that conversation early. Just thank you so much for joining us here today. As a reminder, some of the questions from today's sessions may be included in upcoming updates to the frequently asked questions. The recordings of this session will be available soon on iLearn from the Global Funds website, as well as the slides, which will be available for download right next to the link to watch it. So if you're looking for those, that is where you can go. So thank you very much today, and we look forward to seeing you at some of the upcoming sessions that we have mentioned throughout the day. So thank you and have a great day.
Thank you, everyone.
Goodbye.
Thank you. Bye-bye.
Bye-bye.